Great.
Sure.
So firstly, I would like to welcome all of you to MIT Sloan India's speaker series. And thank you so much, Dr. Shetty, for taking the time to be with us here today. While I'm sure everyone here probably knows Dr. Shetty and knows about your background, I would like to take a couple minutes to just talk about him a bit more. Dr. Shetty is an Indian entrepreneur and cardiac surgeon who is the chairman and founder of Narayana Health, a chain of 21 medical centers in India. Narayana Health follows the principle that quality and lowest cost are not mutually exclusive when it comes to healthcare delivery. Dr. Shetty believes that if a solution is not affordable, then it's not a solution. He has a vision of providing every Indian child with the same medical care as a child in the US. He has performed more than 16,000 heart operations and was appointed by the Supreme Court of India as part of the National Task Force to facilitate public health response during the COVID-19 pandemic. In 2004, he was awarded the Padma Shri, the fourth highest civilian award, followed by the Padma Bhushan in 2012, the third highest civilian award by the Government of India for his contribution to the field of affordable healthcare. Dr. Shetty, in today's conversation, I hope to cover three key themes, and I'll just give you a quick roadmap so we can go according in that order. The first one is around your entrepreneurial journey from a professional, from a doctor to an entrepreneur with Narayana Health. Secondly, the future of healthcare in India, and finally, India's response to COVID. And to everyone who's just joined, we've posted a link for asking questions. Please feel free to post your questions on Slido, and we'll leave some time to ask those questions and incorporate them as we go along. Dr. Shetty, to begin our conversation, I'm going to take the liberty to quote you. "We underestimate the power of purpose. When we are sure, when we are convinced about the purpose of our actions, everything else becomes a minor detail." Here at Sloan as well, many of our classes are focused on helping us think through what our purpose is and how that purpose eventually links to our long-term vision. And I think you're the best example of someone who's been able to link your purpose to your professional journey. And I would love to kick off the discussion with understanding, how did you discover your purpose and how did that lead to the founding of Narayana Health eventually?
Thanks, Avika. Thank you so much. First of all, you all have to have an understanding about a country with 1.3 billion people, which produces about 24 to 26 million babies a year. Every day, I see about 50 to 100 patients in my clinic, and I operate on at least a few of them. And a typical patient of mine is a little baby sitting on the mother's lap. I examine the kid and I tell the mother that her baby has a hole in the heart and she needs to go for an open heart surgery. She has only one question. It's not about the outcome. It's not about the scar. She has only one question, and that is how much it is going to cost. And if I tell her that it is going to cost $1,000, which she doesn't have, that is a price tag on that child's life. If she comes up with $1,000, she can have the child. If she doesn't have $1,000, she is going to lose the child. This is what I do. This is what every doctor in developing countries do from morning till evening, putting price tag on human life. If after centuries of so-called civilization, if the society gives privilege to people like us to put a price tag on human life, we have failed as a society. Something needs to be done about it. And as a doctor, only thing I can do is to work hard to reduce the cost of healthcare. And this is what we did all these years. I left England in 1989. And it's been a very happy journey of having been able to make some difference. India requires close to 2 million heart surgeries a year. And we are only doing about 150,000 heart operations out of the 2 million. So we have a long, long way to go. And this is what motivates us. This is what makes us jump out of the bed every day in the morning and run for work.
And Dr. Shetty, so in your Netflix documentary that I saw as well, you had spoken about your journey of how you met Mother Teresa and how that informed a lot of your journey going from a surgeon to an entrepreneur. And would love if you could talk a bit more on that. And what was your aha moment where you realized that, beyond just being a doctor, you also want to focus on reducing the cost of healthcare?
My relatively short experience and the acquaintance with the mother made a huge impact on the way I look at life. Being a Catholic nun, her famous quote was, "Hands that help are holier than the lips that pray." And she truly believed in that. And her life stands for what she believes. What I could learn from Mother is the most simplistic approach to the life's complex problems. And this is what I try to do in my day-to-day life, constantly looking for simple solution to life's complex problem. There is nothing like one big problem. There are thousands of small problems. Together, they appear like a big problem. So we have to keep addressing one small problem at a time.
Got it. Thank you so much, Dr. Shetty, for describing that. And I really do think for a lot of our students on the call as well, this is going to inspire us to try and link that purpose with profession. There are also a number of students at MIT who are focused on wanting to build a business. And the first couple things that everyone thinks of once they've conceptualized their idea is, how can we achieve sufficient scale? And you scaled Narayana Health from 40 doctors in 2000 to more than 1,800 doctors across 21 plus hospital chains in the country and also internationally in the Cayman Islands. Would be very interesting to hear from you. What are some of the key success factors that enabled this scaling? And could you also highlight some of the lessons that you learned along the way in building this business?
Any business you all want to build, look at the scale. It has to reach millions and millions of people. If you're not going to touch the lives of millions and millions of people, the effort is not worthwhile. You don't need to be a graduate of MIT Sloan Business School. If you want to make it scalable to that level, it's very important that you make it affordable, because affordability is the only way millions of people can access the healthcare. So this has been our primary focus, reducing the cost of heart operation. When I did my first heart operation about 31 years ago, heart surgery was costing about over $2,500, about $3,000. And 30 years later, we are able to do the same operation with perhaps better outcome at half the price. Now, you tell me what was $3,000 30 years ago is costing you in service sector, not in manufacturing, costing you less than half. It's unbelievable what has happened. It's a greatest tribute to the passionate Indian doctors, nurses, technicians who really slog for this to happen. One of the in service industry, especially healthcare, uncertainty of the cost is something which we have to address. So we have a policy that when the patient comes for the surgery, first of all, I want to let you know that less than 10% of our country's population has a private health insurance. It's a very small percentage. And good number of them today, by the government scheme, they are covered. They are saved. But nearly half the country's population doesn't have any health coverage. They have to pay out of pocket. So predictability is very important. Like we do the heart operation. Supposing we give a package that after the the entire operation is going to cost you, say, $2,000 or $3,000, irrespective of what happens to the patient, whether they stay in the ICU for hospital for 1 week or 1 month or 2 months. They don't pay anything extra. And that brings a lot of credibility. The most important thing in business is trust and credibility. You may rather lose money, but not the trust and credibility. So these are the, also when you build a enterprise, it's very important to surround yourself with very smart people, because none of us are as smart as all of us. So we are blessed in having a wonderful team of people. And the most important thing in healthcare enterprise is that outstanding doctors with magic in their fingers are eccentrics. So we need to understand their eccentricities, and we have to build the institution to suit the eccentricities. And these are the few lessons we learned. And every 5 years, we reinvent ourselves. There is nothing like we did this for 30 years and we are going to do it for next 30 years. Every 5 years, we reinvent ourselves.
And just to follow up on what you said, that a large part of the reason why $3,000 has now become half the cost, a lot of it credit to the passionate doctors that are in the country today. But to understand from a business perspective, how do you balance, things like retaining talent by making sure their salaries are high enough, at the same time keeping the costs low, ensuring that technology and innovation is still, you're using the best technology for the surgeries and keeping costs low and ensuring that you have the best talent? How do you manage that balance?
We do not pay the doctors less than what other corporate, typical private hospital in India pays. We pay the more or less the same salary. But in the other hospital, if they're doing 1 heart surgery a day, here we expect them to do 2 or 3 heart operations in a day. Their productivity is more, because in the building, about 12 to 14% of the heart surgeries done in India is done by our group. The hospital where I work, we do between 35 to 40, 45 heart operations every day. So there are enough patients for all of them to keep themselves busy. They are paid well, they earn good money, but they contribute significantly. And this is what doctors like. Doctors are like technicians, they're like artists. So as they have more operations, they enjoy doing the procedure. And when you're controlling about 12-14% of the Indian market, naturally you have an advantage in procurement of various disposables and equipments and the infrastructure. So essentially large scale gives you a lot of unfair advantage, which you can use it for helping your clients.
Got it. Thank you. One of the questions from the audience that we've seen is around how do you think the Narayana Health model is replicable in other developing countries? What do you think will be the key risks or challenges for international expansion? And I know that Cayman Islands is a location that you guys have piloted with, but any other developing countries that are on the map, and what are some challenges that you foresee?
India is a very uniquely placed country where we produce the largest number of doctors in the world. We currently have about 80 to 90,000 medical seats. That means that every year that many doctors are being trained. So and we produce the largest number of nurses, medical technicians in the world. So we are the main providers of the skilled workforce to a good number of the countries, because ultimately healthcare is nothing but the skill of the people. It's the interaction between the man and the machine. So essentially, when we have large number of extremely talented doctors, like I just want to quote you, about a few years ago, Harvard Business School conducted a study in which they have shown clearly that the Americans who are treated by expat doctors, mainly Indians, lived longer than the Americans who are treated by American doctors. So brand India in the medical field is accepted globally. So we have a unique position to expand our services outside India as well. And you may know that across the world, there is shortage of over 80 million health workforce. That is compounded by, or the COVID exposed the soft underbelly of healthcare delivery across the world. 80 million healthcare workforce shortage. And no country has a very clear plan to produce them. And you cannot produce healthcare professionals in 1 year or 6 months. It takes more than 14 years to train a heart surgeon or a neurosurgeon. It's a very long drawn process. So we are trying to impress on our government that we have a unique opportunity now to reach out to rest of the world and try to help them out with the hope that eventually every country will have the infrastructure to train their own doctors. But some countries have a serious problem, like small countries with 1 million, 2 million people. They cannot have a medical school. They can't have a nursing school which can train thousands and thousands of doctors, nurses, medical technicians. So we have a unique opportunity in India.
Got it. Thank you. Just trying to shift gears a bit towards the current status of healthcare in the world, in India, and the future of the healthcare industry. So currently, healthcare is a $8 trillion industry, and still at least half of the world's population can't obtain healthcare services. And this number is perhaps even lower in emerging markets. What do you see are the greatest challenges India faces to increase access to healthcare and improve the quality of healthcare for the underprivileged?
India's greatest handicap right now, even though we produce the largest number of doctors, we have acute shortage of medical specialists. We have acute shortage of nurses and technicians. This has to change. Now, for this to happen, there should be a major reforms in medical education. You may get shocked to hear that it costs over $100 million to set up a medical school in India. It is much bigger than a real white elephant. We can buy a medical school in Caribbean for $2 million, which can train doctors to serve American healthcare. But in India, if you want to set up a medical college, it's going to cost $100 million. And there aren't that many teaching hospitals in India because we need to be licensed to be teaching hospital. Like in the US, about 25-26% of hospitals across the US are teaching hospitals, training medical specialists. Like you look at England. England has perhaps 10 times more post-graduation slots to train medical specialists than the undergraduates. So that large number of overseas doctors like us go to England, serve the NHS, get trained, and stay there or choose to come back. So we need to have the same strategy because like I went to England, I got trained as a heart surgeon. I had the privilege of working in some of the best British hospitals, perhaps some of the best European hospitals. So like us today, young doctors from Africa and other Asian countries are looking at India as a place where they can get the training. But our regulation doesn't allow that. So we need to change our regulation. And once we change our regulations, we will be able to transform the way healthcare is delivered. And the other missing link is the financial intermediary. As I said, still half the country's population pay from the pocket. We need to have a low-cost health insurance program. Around 15, 16 years ago, we launched a health insurance for the farmers of my state, Karnataka state, with a premium of 11 cents per month. It is essentially a government scheme. All of the private hospitals came together and encouraged the government to start the health insurance scheme. And government agreed to become a reinsurer. And the insurance paid only for the surgeries. and about 600 to 700 varieties of surgeries were covered. And this insurance ran for 12 years. And over 1.3 million farmers had varieties of surgeries, and over 150,000 farmers had a heart operation just by paying 11 cents per month. Imagine we have currently over 900 million people who spend about 5 to 7, $8 per month just to speak on the mobile phone. Now, if we can ask them to pay $1 a month for the healthcare, we can have a phenomenal health insurance program. So this is the power of technology which has brought all the people together. And the cost of collecting $1 is nothing because they pay the mobile phone bill and this can be collected along with that. So we have a unique opportunity to transform the way healthcare is delivered.
And, Dr. Shetty, you mentioned the role of the government in terms of regulation changes, whether it comes to education as well as insurance. In terms of the role of other stakeholders across the value chain to address these challenges, of course, whether it's the government, whether it's your big pharma, hospitals, how do you see each of these stakeholders' role evolve over time in terms of what they can do?
See, in any country, government is a very, very powerful and a powerful entity which can transform everything. Like I'll give you an example. You are very familiar with the Indian scenario. In India, our biggest problem is lack of education for millions and millions of people. Literacy is not education. Education is knowledge and skill. In our country, our biggest problem today is after completing 10th standard, when you join the university, unless the parents have the money to pay for the education, you cannot train a doctor, engineer, nurse, or a technician. So we need to have a system sponsored by the government where students can earn while learning. And medical and nursing technical fields are ideally poised for that. Because after your 10th standard, instead of doing 2 years of pre-university education, if these girls and boys coming from poor families are allowed to work and earn as an auxiliary nursing midwife for 2 years, when they're student themselves, they can earn money. So parents don't need to spend the money. This is very important. We run a nursing school. We are willing to offer nursing education to girls from poor families free of cost. But a girl to stay in Bangalore, away from home in a hostel, costs 10,000 rupees per month. I can tell you more than half the country's population cannot afford to keep paying 10,000 rupees for one child to get the nursing training for 4 years. That is not possible. So unless we create a vehicle wherein education, mainstream education will happen as it is, but there is another stream of education where they can pay while they can earn when they are studying, we will never see a major transformation of poor families becoming middle class and wealthy. And these are the changes which government can do. In terms of hospitals, unless we go for a massive digital disruption of healthcare delivery, with no paper, there is no pen. If we just remove the pen and paper from the healthcare industry, I can guarantee that the mortality, morbidity in the hospital will come down significantly. And India is blessed in having great software engineers who can create magic software which can virtually like a magic. And we are in a fantastic position to create that magical transformation. And Indian pharmaceutical companies are now getting into original research. As you're aware, we are one of the pharmacies of the world, and we could produce our own COVID vaccine in a short duration of time. So a lot of things are changing. And I am convinced that India will become the first country in the world to dissociate healthcare from affluence. India will prove to the world that the wealth of the nation has nothing to do with the quality of healthcare its citizens can enjoy. And it will happen in my lifetime. I'm very sure about it.
Yeah, we're all hoping for that. And, you mentioned a very interesting point around that during COVID, the vaccine was developed in such a short period of time, and just leads me on to my next topic around how the long-term impacts that COVID had and continues to have on India's fundamental healthcare system, the good and the bad. And would love to understand, details around some of the good things also that came out of the pandemic on how the healthcare system functioned, and as well as the challenges that were exposed.
100 years from now, if some historians are going to write the history of the world in the last 100 years, there will be two distinct periods. One is BC, that is before COVID. Other one is AC, that is after COVID. Because the world we enter after COVID is going to be dramatically different before the COVID. I'll give an example. Look at one aspect of doctors' activity, that is telemedicine, that is seeing patients online. I was seeing patients online well before the internet. Indian Space Research Organization, as you know, it's one of the fourth or fifth country in the world which can put satellite on the space. And their headquarters is located in Bangalore. That's the Indian Space Research Organization. They gave me a huge dish antenna on my rooftop of the hospital. They linked our hospital with a large number of public hospitals. And I treated 53,000 heart patients using a satellite link before internet became a reality. But then we reached a stage wherein in a mobile phone we could treat patients. But till COVID came, treating patients online was illegal. But as soon as the COVID came, the government forced the medical council to change the regulation, and illegal telemedicine became legal. Then in no time, everyone, patients, doctors, everyone embraced digital online consultation. I can tell you that COVID brought forward digital transformation of the services by at least 20 years. And going forward, the way the hospital works will be dramatically different. When you enter a typical hospital, there will be reception without receptionist. Because everything what a receptionist does will be done online with the patient at home and the receptionist at home. There will be large intensive care unit without intensivist. Intensivist will be sitting at home, managing the patients online on their the laptop or a mobile phone or whatever. And the technology is already here. In the near future, smart software will make smarter diagnosis than the doctors. Within the next 5 to 7 years, I wouldn't be surprised if it becomes legally mandatory for a doctor to get the second opinion from the software before starting the treatment. In the hospitals, during the COVID time, we were worried about the safety of all the support staff, the porters who shift materials from one end to the other. They bring blood bag from the blood bank to the operating room. All this so-called portable activity will be done by very, very inexpensive robots. So eventually inside the hospital, only the people who are going to touch the patients are going to be working. All the others will be working from home, supporting not one hospital, multiple hospitals. So essentially, everything what we do in healthcare will undergo dramatic change. And the bad thing about the COVID, what we are now experiencing is that millions and millions of people are going to suffer from the lung disease. And with our observation, it looks as if it is reversible, but only time will say.
Dr. Shetty, you mentioned around, the advent of artificial intelligence, robots, etc., taking over some of the healthcare, the portable activities. Two questions on that. One is, do you think that the countries are actually ready to move towards non-human interaction? Because when we think of medical service, when we think of, when someone is unwell, having that human touch is still so important mentally. That would be keen to understand your view on how you think, whether you think there's actually scope for that to change completely. And B, also would be interesting to hear your views on the way the vaccine was, all the permissions were approved faster than any other vaccine in the world in the history of time. And do you think that means that we're going to find cures to diseases faster, sooner? Is the regulation going to become more improved as we go forward?
See, first of all, healthcare industry is the largest industry in the world. It is bigger than the food industry. We spend more money in keeping ourselves healthy. I think it's about 8.4, 8.6 trillion dollars. Agro industry is only less than 8 trillion. With this kind of money, lot of things can happen. Now, when it is a question of human interaction, it is extremely important. I believe in the power of touch. But what digital world can take you is to a dramatically different level. A little baby in Bangladesh, 2-month-old baby with a hole in the heart. If the baby parents want to see me personally, they have to travel by flight or a road. The journey can take by train 3.5 to 4 days. Carrying the little baby to Bangalore, and our doctors do the echo, which can be done in Bangladesh, and they find the hole is very small. And I tell the mother that, look, the baby doesn't need operation. Today, all that is addressed online. When somebody sends me an email saying that, look, my child has a hole in the heart, can I have an appointment? First thing I'll do is to ask them to get the echocardiogram done in any diagnostic lab in Bangladesh. And I see the child online, and I talk to the mother, and I tell them that don't bother. There is no need to come. Wait for a year. We'll repeat the echocardiogram. So you are looking at a different world altogether online. It is like, I understand as a doctor that I have major emphasis. I love the concept of touch and physical contact and the eye contact. But digital world can offer something dramatically different. Today, when a patient has a major operation, patient is at home after the surgery, everything is fine. 24 hours later, the patient's attendant gets a call from my office saying that Dr. Shetty wants to see you. And they get surprised in their mobile phone, in WhatsApp or whatever. I see the patient, then I ask the patient to show me the scar. And if the patient says I have a cough, I see the throat, and it's like as if I'm doing the rounds in their house. It's an amazing experience. It is like, when Henry Ford was asked whether he conducted a survey to find out whether Model T was required, he said people would have asked for a faster horse before the Model T. So essentially, what we are talking about is a different entity altogether of an online healthcare. And that is going to have a massive, massive impact on the recovery, early diagnosis. If people hate going to the doctor's clinic, if you tell the patient, you don't need to come to my clinic, I'll see you online. If there is any test required, you can get it done in the neighboring diagnostic lab and you can see me with the report. Then people will consult the doctors online, very early stage of the disease. They won't wait for the chest pain to become a heart attack. They won't wait for a neck swelling to become an advanced cancer. Everything will be diagnosed at the early stage. And when disease is diagnosed at the early stage, you can cure them. But when you present yourself to the doctor at a late stage, what always happens because of the mental block of the patient of going to the hospital, no matter how much money you spend, you can't cure them.
And taking, continuing in that same trajectory, we spoke about some of these trends in terms of, more telehealth and things moving digital. What are some other trends that you see will shape the healthcare industry in India going forward? And which are the trends that you are most excited about, whether data, mental health, consumer-focused health, and any others?
The largest growth segment in India is going to be the financial intermediary who will be able to collect money from large number of people and pay for the healthcare of a small percentage of the people. You may call it as a health mutual or a health insurance or any of those, but that is going to be the largest growth segment, because paying from the pocket, out of pocket expense for healthcare is huge. And that is the biggest problem today in healthcare. Once there is a financial intermediary which will come up, which will pay for the healthcare, and the premium is affordable, major transformation will happen. And we are optimistic that various digital tools, fintech companies will be able to bridge the gap in financing for the healthcare. This is going to be a major trend. The other trend is as I said, digital healthcare, wherein every patient will have their medical data on their own mobile phone. Like today, when a patient comes, a typical patient carries this thick file with everything written. Takes about a couple of hours for a doctor to decipher all those papers. Now, it's a matter of time before every patient will have their medical data in their mobile phone. And when they go to the doctors, all they do is to scan the QR code and we can get the entire data. So you don't need to keep on asking the same old boring question like, what is your past history, family history, allergy? Because none of them change. If he has given the entire list of family history, what's the point in repeating the same thing? So essentially, the way a patient interacts with the doctors will undergo change.
And Dr. Shetty, there's a very popular question on the question board that I want to get to before we lose time, is that over the years, you've built an empire and revolutionized the healthcare industry in India. How did technology and data accelerate the company's productivity?
Right. This is a very interesting question. I wish I could show in my phone. We have a team of very smart software engineers who have created amazing electronic medical records, which we enjoy using it. And I go to bed at 11 o'clock at night. And before I go to bed, I finish the ICU rounds. I see each and every patient. I see the cardiac monitor. I see the blood gas report. I interact with the doctors. I can prescribe medicine. I can ask for investigations. I can even communicate with the family. I can do everything in my mobile phone in this app called Adi. This is the way it looks like. I'm not sure whether you can see it. So it's like a WhatsApp with we can send photographs, we can interact, we can do everything. And I'm up at 5 o'clock, 4:30, 5 o'clock in the morning. First thing I do is to do the ITU rounds. And today, before I enter the hospital, early morning, I would have finished my rounds. I know everything what is happening with the patient. If I would have seen the chest x-rays of every patient. So essentially, what will happen is that the outcome of healthcare will undergo dramatic change when the data is visible to the doctors in their own mobile phone. Like all the billion-dollar electronic medical records of US are built for the desktop. Doctors look at the desktop 5 to 6 times in a day. they look at the mobile phone 200 times in a day. So if you want doctor's attention, you should build your electronic medical records on a mobile platform so that doctors can see it on their mobile phone. Now, I'll give you one aspect of healthcare which will have a massive impact on with the digitization. That is a critical care unit. That is the largest growth segment in healthcare. Believe me, in the near future, half the beds of every hospital will be critical care unit bed. Now, when this transformation happens, what will happen is there will not be sufficient number of intensivists who are trained to manage these patients, because intensive care unit is a 24-hour service. So young doctors don't want to be intensivists. So whether in US or in India or in Europe, a patient in the critical ICU gets the best care between 9 to 5 when all the senior doctors are there. 16 hours in a day in the 24-hour cycle. Patient gets suboptimal care in US, Europe, India, everywhere, because they're taken care by junior doctors, junior nurses, and everyone who are not that experienced, because you don't expect senior doctors to spend 16 hours in the ICU taking care of the patient. Now, imagine a situation, all the data of the patient is online. An intensivist sitting in his drawing room can see the patient's cardiac monitor, he can see the patient, talk to the patient, look at even the color of the urine, and look at all the data. And you split the 16 hours into 4-hour slots. And each intensivist is asked to go home at 5 o'clock, 9 to 5 job they do. But once they go home, every third day, they cover only 4 hours. But in 4 hours, they cover 20 patients. And they document everything. That means a patient gets the best care by doctors staying at home who are not sleep deprived, and they work only 4 hours at night. So essentially, when we do this change in the shift, first of all, ICU job will become attractive and patient will get better care, and the outcome of mortality, morbidity in the ICU will go down significantly, with tremendous job satisfaction among the intensivists and the senior nurses. So these are the dramatic shifts you will see happening in the near future with the digitization.
And you showed us the app that you have. Is this a Narayana Health specific app? Because I mean, maybe I'm not very aware on this, but I'm not sure how many hospitals in India are actually following through with full digitization of electronic medical records. And is it a Narayana Health specific application that has been developed?
See, we have been trying to develop electronic medical records for more than 20 years, but I think about 6-7 years ago, our team took a major decision that we should develop it ourselves, because our experience of working with outsiders wasn't very pleasant. Because nobody as I said, doctors are like artists. For us, when you develop a software, the UI experience, user interaction should be very good. It should look elegant. We should enjoy the process of using the software. And that we couldn't get it with vendors. So we decided to do it ourselves. Now, about how many hospitals have digital tools, my assessment after talking to various leading doctors at different parts of the world, nearly 80% of the world's hospitals do not have hospital management system which is synced with the electronic medical records. More than 80% of the hospitals. So unless you have a digital platform where the hospital management system and the electronic medical records are synced, you can never have that amazing experience. Like in my phone, as soon as the chest X-ray is done, I see the X-ray in my phone. As soon as the blood gas machine spits out the results, I see it in my phone. So this is the beauty of connected institution, where every machine is synced, every patient is synced, Like, I'll give you a simple example. The nurses in the ward, their job is to go to every bed every 4 hours and spend 15 to 20 minutes with each patient, checking the temperature, checking the pulse rate, counting the respiration, checking the blood pressure. It's the most boring job. By the time they finish 30 patients, they're again doing the second round. It is the most boring job. Why should a nurse who's qualified, was trained for 4 years, worked in the hospital for so many years, should be reduced to the level of checking the blood pressure and the temperature when there are fantastic sensors? So all we do is to put one patch, and that gives you the ECG with analytics, with the temperature, respiratory rate, blood pressure, everything comes. And on the nursing station, there is a TV with the patient's name, and it shows the green color flag. That means everything is fine. When it shows orange or red, the nurses will go to the bedside and address. So essentially, everyone involved in healthcare, their job should be taken to the next level, and the mundane job should be done by the digital tools.
Wow, this honestly, this sounds absolutely incredible. And I think for a lot of people on the call, especially where MIT is positioned with Boston having a focus on healthcare and MIT itself's focus on data and analytics, this is incredible to hear, and a lot of opportunity in the future as well. We have about 13, 14 minutes left. A couple questions that are coming up. One is around how did you manage your time between your leadership outside of the clinic and remaining competent in surgery?
Surgery is my passion. I love operating, but I have now zeroed down on one or two types of operation I enjoy doing. There is a procedure called pulmonary endarterectomy, and you said you watched Netflix. In that, I was demonstrating that operation. This is one operation I enjoy doing it, and I do this operation very regularly. And till the last day of my life, I hope to remain fit and be in a position to operate. That's my passion. Apart from that, I enjoy, working with various organizations and trying to change the healthcare policies of the country, and if possible, outside the country as well. Essentially, there is a lot of time. Whatever I'm doing, I'm trying to look at in a short period of time how we can spread healthcare to everyone. And as the time passes by, I realize that it's not as complicated as I thought it was. It is relatively easy, and things are happening much faster now than what used to happen 10, 20 years ago.
And Dr. Shetty, coming back to a little bit on the COVID lens, so you played a critical role in leading some of the public health response in India towards the pandemic, especially in Karnataka. And would love to understand your views on what are some of the things that you think India did well, and some things that could have been improved in responding to the pandemic.
See, the early lockdown imposed by the government is the best thing we did, because that gave us time to prepare the PPEs. Now everybody knows what PPE is. And we hardly had 30,000 ventilators. In 3 months, we created, we virtually tripled the number of ventilators. And more than anything else, because we took a break, we could see how the COVID protocol is evolving in Europe. Britain got much ahead of us, and we are closely linked with Britain, and we could learn the protocol. First thing is, okay, COVID patient, you have to give steroid. That made a massive difference. And the other thing is how the country has done during the COVID. I know there are a lot of debates going on about, Indian mortality is very high. Whatever figures we are getting is not accurate. Believe me, the figures you are getting is more or less accurate. I tell you, our mortality is one of the lowest in the world. I'll tell you why. Thanks to the unbridled, chaotic health system of the country, Everywhere you travel on a highway, every 1 kilometer you find a hospital. It may be 10-bed hospital, 20-bed hospital. And when somebody puts a board, because in India, you don't need a major regulatory process to get the license to start a hospital. When you say a hospital, hospital has a bed, there are few nurses, they have oxygen, they can give IV fluid, and they have steroids. Now, what treatment made a massive difference in the outcome of COVID patients? That is oxygen and steroid. And oxygen and steroid is available in India, every nook and corner of the country, because of the unbridled growth of private hospitals. So if somebody didn't get admission in a public hospital, they got admitted to a nursing home and they got the same oxygen and the same steroid as a patient in one of the American hospitals or NHS hospitals. And that is the reason why our mortality is low. Whereas in countries like Europe, in countries in Europe or in US, you have a regulation which prevents people from building hospitals. So your system is created to cater for the peacetime, not for the extremes of COVID and this kind of a pandemic situation. So people didn't get the bed. Now, you would have seen some photographs appearing in newspapers of the oxygen running out and people buying oxygen, bringing it home. Every country went through the same phase. There was shortage of oxygen in every country. But in most countries, if the government decides that, okay, if there is no bed, you stay at home, we'll support you whatever way it's possible, people follow. But in India, we are known to take care of ourselves. If the government is not able to provide the bed and the oxygen, people will go and buy the oxygen. We know how to help ourselves. So everyone who mother or a father was having a low oxygen level and there was no ICU bed, they didn't just say that, okay, it will get better. When the patient gets better, we take them elsewhere. No, they wanted to help themselves. So essentially, when it is a question of mortality following COVID, India has done the best only because COVID treatment is oxygen and steroid, and that makes the maximum difference. Ventilator, ICU care may make a difference, may not. So we did the best.
Got it. And in terms of, there's a hot take around, do you think India and the world are out of the pandemic? We started in March 2020. Everyone thought this will be 6 months, 3 months, and now we're April 2022, and it's still more or less continuing. So would love to get your take on where do you think the future is with COVID?
First of all, if there was no COVID test, there was no third COVID wave in India. Last COVID wave wasn't really a wave. It was mainly a wave of millions of people getting tested positive, but very few of them landed in the hospital. We were preparing ourselves for the worst possible outcome with Omicron. We created 800 COVID ICU beds in our health city. We had 23 patients. That too, most of them were the patient who were staying in the ICU from the second wave. So this is exactly how the Spanish flu happened. Spanish flu, if you read the history, it lasted for 18 months. And during that time, there was no test for Spanish flu. And people had a cold and cough, maybe due to Spanish flu, but it wasn't diagnosed, but they didn't land in the hospital. So nobody thought there was a next wave. Whereas in India, all over the world, we have today, everywhere there are testing facilities. So more and more people getting diagnosed with the COVID, but till date, hardly any admission, hardly any patients in the ICU. So governments have to change the policies. They should not keep publishing the positivity rate. They should only talk about how many patients are in the ICU. And that is what matters. And I'm optimistic that there will not be anything significant. There will be large number of people getting tested positive, but very few of them will land in the ICU.
Got it. Thank you. Thank you for that. We have last 3-4 minutes, just 1 or 2 more questions. The last one around, just what advice do you have for the students on this call or budding entrepreneurs or anyone interested in the healthcare space, how they can tap into the healthcare space going forward in developing markets? What opportunities do they have to be part of this industry?
First of all, let's be agnostic to the industry. You're all youngsters coming out of the graduating, business school with major plans for the future, and most of you want to become entrepreneurs. It doesn't matter whether you take up healthcare or technology or anything. Typically, a startup starts with 2-3 friends getting together, trying to see what we can do. It's all about the questions you all ask with each other is, what shall we do? Once you decide on what, answer for the question what. Next question you all ask amongst yourself is how to do it. How to raise the money, where to have the factory, how many people we hire, and the budget, and it's all about the how. But most of the time, you all never ask the question, why? Why do we do it? My suggestion to all of you, ask that question first. If the answer to the why is something which is going to help millions and millions of people, believe me, cosmic forces will come together. They virtually connive for you to succeed. So your why is the most important entity in your success, which again proves the power of the purpose. I just want to give you a very interesting statement which I read from Upanishads. It is about the power of purpose. That says, this is Patanjali, one of the Upanishads, is the ancient scripture of India, which says, when you are inspired by some great purpose, some extraordinary project, all your thoughts break their bonds. Your mind transcends limitations. Your consciousness expands in every direction, and you find yourself in a new, great, and wonderful world. Dormant forces, faculties, and talents become alive, and you discover yourself to be a greater person by far than you ever dreamt. This is the power of purpose, and my advice to all of you is to look at the needs of the common man of this world. Doesn't matter whether it's India or Europe or US, doesn't matter, and you will always succeed.
Thank you so much, Dr. Shetty, and thank you so much for the advice. It was a true privilege to host you, and honestly, I'm sure everyone on this call has taken away so many great learnings and lessons from you, and we hope to do this next time, maybe in person, and looking forward to seeing you, and thank you once again for your time.
Thanks, Alika. Thank you.
Thank you.
Thank you.